Hi, myself Dr. Praveen Kumar, a consultant rheumatologist at Daivik Arthritis and Rheumatology Center. I would like to brief about the gout. Gout is one of the commonest crystal arthropathy, meaning deposition of the uric acid in the joint. So usually it affects the middle to older age group, that is from 30 to 60 years of age group, and it's predominantly common in males. So it may also occur in the female only after menopause, means after the period stops, usually after 60 years of the age, because the estrogen in the female will protect the deposition of the uric acid. Rather, it will increases the uric acid excretion in the kidney. So, uric acid is harmful to us? No. So, uric acid is a byproduct of metabolism of the proteins. Usually, it will be normally excreted through the kidney. So, in a patients or in an individual where there is an increased production of the uric acid, either from the diet or from the body itself, so the uric acid will not be able to excrete it in the adequate amount, or sometimes the uric acid will not get excreted in the adequate amount in spite of normal uric acid production. So in these two situations, uric acid will get deposited. So where and all the uric acid will get deposited? Usually it may get deposited in the kidney, leading to a renal stones, or it may get deposited in the joint, leading to a arthritis. So most commonly it will get deposited in the great toe. It can affect any joint, maybe in the joints of the hands or elbow or the shoulder or a knee or a great toe. So but commonly it affects the great toe. So usually they will come with the severe pain and the swelling and also redness and also warmness around the joint. So usually it may last for 2 to 3 days. Even sometimes without a treatment, usually in the first episode it get resolved, but it usually reoccurs after sometimes, usually after 6 months to 1 year. So once it reoccurs, so the pain intensity will be more severe and it usually lasts for longer duration. So usually after the first episode, so there will be reoccurrence of the joint pain and symptoms. So during this period, there will be more accumulation of the uric acid in the joint. So over the period of the time, it will get deposited in other joints like knee joint, or it may be over the hands, or it may be over the shoulder and elbow, leading to a more severity of the symptoms, and also at the same time more frequent attack of the symptoms, and also it will take longer time for the resolution of the inflammation. So that's why it's important that they should consult a rheumatologist when very early in the disease process. So usually what causes this increased uric acid in the body? It can be because of the dietary changes, increased non-vegetarian food intake such as red meat, or it may be a increased alcohol intake which will lead to the increased production of the uric acid, or it may be because of the obesity. So in obesity, there will be increased production and also decreased excretion of the uric acid. So in those conditions as well, the uric acid will be deposited in the joint. So how do you diagnose this condition? Usually the typical symptoms along with the blood tests such as a serum uric acid and a routine blood test will help in the diagnosis, and the ultrasound examination of the joint will definitely confirm the gout in the most of the cases. And also we usually screen for a renal stones through the by the ultrasound of the abdomen. So what is the treatment for this? Usually there are as far as the treatment is considered, one is a pharmacological therapy, which is a drug, another is a non-pharmacological therapy. So in non-pharmacological therapy, so we will ask the patient to reduce the weight and follow a healthy lifestyle, and to reduce the high purine diet, means in the sense they should decrease or avoid the alcohol, and they should stop the non-veg intake except for the fish. So usually red meat is the one which is a culprit in most of the non-vegetarians, and also such as sprouts or spinach. So these are the one which contains high purine. Even the fructose-rich drinks such as cola or Pepsi, even those also will have the high purine content, will precipitate this gout. So usually avoiding these will reduce the uric acid by 10 to 20%, and other pharmacological therapy will help to keep the symptoms of the gout at the bay and also reduce the uric acid for a long time. So there is two way or two different drugs. One is to reduce the uric acid, another one is to reduce the inflammation. To reduce the inflammation, we usually prescribe the painkillers, and in severe cases, steroids. So and other anti-gout therapies will be prescribed. So in nutshell, so early diagnosis and change in the lifestyle are a key in the management of the gout. Thank you.